I think that one of the most important things when you are working in the community is don't think inside the box. This started out as a dream with a group of us that were sitting around a table that were going, can we actually do this? Can we actually provide a simple way to empower our communities to have better health literacy? Carteret County is a unique county in that it's about 65 miles from one end of it to the other.
We've got water around us. We've got farmland around us.
Narrow roads, 2-lane roads. If we get a good nor'easter and that tide's high, they could get flooded out.
It's very important in this rural community that we live in that we are meeting people where they are.
They don't want to come to see the doctor. They'll come to see us.
The mobile medical unit is probably one of the most vital resources that we have in Carteret County. We were so fortunate because we did not have to talk anybody into anything. It was really the vision of our senior administrative team as well as our board of directors to really push this initiative forward.
So when we first started this model, we actually started parking it in a parking lot at maybe a church or just parking it somewhere that there wasn't a lot of foot traffic. And I think we learned really quickly that you've got to meet people where they are. And so we looked at areas in our community that had foot traffic and why they had that foot traffic. And so we got permission from different places and we were able to use their parking lots. And so by taking the bus into those community areas, it gave them a place that they could come consistently. And then it also, they knew that if they had a problem, then they were going to have an advocate to be able to help them get what they needed.
For some reason, when they get on this bus and they see 4 women and Randall, they become very relaxed and they will tell us things that I don't think they would tell their doctor.
Hey, ma'am.
Well, hello.
Let me help you here. There's
Oh,
a bar
thank you.
there for you.
Thank you so much.
We developed a health passport. That health passport is a way for those patients or those people or those community members to then share the information that we had provided for them while they're out on the medical unit and then close the loop and get it back to their providers.
Have you had any of these?
No, ma'am.
You have not. Okay, so you're going to be a yellow.
The components of the mobile medical unit include blood pressures.
We're going to put your blood pressure right here.
Mm-hmm.
And these are the AHA's definitions of normal to abnormal blood pressures. Okay?
Then we also do blood sugars, and then we do a cholesterol. So one of the things that as healthcare providers we like to do is empower our patients to be able to monitor themselves at home. If they're able to monitor themselves at home, then they're going to be more compliant with how their blood sugars are running, how their blood pressures are running, or how their cholesterols are running.
I heard that your blood pressure was not optimal, so we are going to teach you how to use a blood pressure cuff. And I heard that you do not have a blood pressure cuff at home, so I'm going to give you a blood pressure cuff, okay?
Well, that's very nice. Thank you.
So here is the sheet that you can write your blood pressure on.
Down.
Make sure that you take that to your doctor when you go to see your doctors.
Sometimes these people did not have providers, and that's where the telehealth piece came in. We utilized the resource that American Heart had provided for us, which was the telehealth certification. And 3 of our team actually has successfully completed that. And it's been a wonderful piece because we're more comfortable, we're confident when we make those phone calls. If we would make a phone call and the patient didn't answer, what kind of information could we leave on the phone as a voicemail through telehealth? What's legal? What's breaking HIPAA? The telehealth certification addressed all of that.
I am a certified telehealth nurse through American Heart Association. And when we take the bus out, we give them a card telling them when we're going to call, and we call within 2 weeks of seeing them.
Hi, this is Marita from Carteret Healthcare Mobile Medical Unit. Yes, we saw you 2 weeks ago.
And we go over how they're doing, what improvements they've done, have they seen their doctor and stuff like that.
So I'm just checking, have you been taking it every day? Good.
Hopefully it will go more than just telephone calls, that we eventually can link up to having a doctor talk to them.
So bringing those services directly to our county population has been very important to us. They have reached out directly because they have seen that we have been at various sites within the community. That has been one of the key factors in us making sure that they have the education that they need to utilize the resources that they have locally.
The mobile medical unit itself is bringing the hospital outside of the walls of the hospital. And it's allowing them to know that we care about you where you live, and that because you live in a remote area doesn't mean that we don't care about your health. Let us do what we can do to give you what you need.